At VSI, we're always trying to do something different for our patients and try to alleviate their pain. One thing that we've started doing is a minimally invasive SI joint fusion. And Mr. Lucas was actually one of our first patients. He's graciously offered us some time to give us some insight into the procedure. Mr. Lucas, the first question for you, or first of all, thank you for doing this.
Sure.
First question is, can you tell me a little bit about what you thought this procedure would be, and then how it actually met your expectations, or how it was different than what you thought?
Well, I believe in the time, I'm not sure, how long have I been coming here to see you?
About
a year?
About 2 years, 1 to 2 years. I think a year and a half to 2 years, yeah.
So we had I had received every injection that was in the drug box.
Yeah.
Pretty much. And some of them I got a little relief from. It might have been 2 or 3 weeks or something like that. Then we double back and use it again, and then it didn't work the second time around. So we kept going, and when you came to me with the possibility of this procedure, it just seemed like the next step, or in the natural progression of where you were going to go. And I didn't hesitate to say, sign me up, because I basically didn't like how I was.
Yeah.
So I had no problems with it, and still don't.
Gotcha. When you're in the procedure, right? So when I'm working back there, hammering away, using my tools, what were you feeling like? So if you can tell, our audience, what can they expect during this procedure?
I had Ricky Nelson singing in one ear with the headphones on, and I knew that you had some sort of stainless device that you were hitting on the head with a hammer. I heard it. Maybe I could feel it knocking on my back, but there was no pain associated.
No pain.
No pain.
Which is good. So what Mr. Lucas is joking about is, luckily what we have are the Apple headphones, or any sort of noise canceling headphones, and so we give them so the patient can kind of be in their own happy place listening to music or whatever they feel, and so that allows us to work, but then they're kind of dissociated. We also use IV sedation, and we numb up the joint and the skin really well to try to make it as painless as possible. And so truly you felt like you could feel some pressure, but you didn't feel too much pain?
Correct, yes.
And we check in on him often, and he'd be like, I'm okay, and it was really awesome.
Yeah, they woke me up.
Yeah. Didn't let you sleep while we were trying to fix you.
Yes.
And then afterwards, recovery, if you can walk me through really quickly, maybe the first couple hours and then the first few days, what can someone expect in terms of recovery?
I think you've got to go slow. I would give that as advice to anybody, and try not to do any unnecessary movements. I mean, twisting, or you dropped a piece of mail on the floor that weighed a half an ounce. Well, that isn't anything. I can pick that up. No, let somebody else pick it up. So we do that, and the port, we talk about whatever the name is for the ice machine. Everybody should have one of those, so when they go home they can use it as needed. And I think that was pretty terrific thing. So I was glad to have that.
Yeah, that's awesome. I think we try to be really strict about our protocol, because doing the procedure is one thing, but then facilitating recovery is another, right? So trying to make sure we're not bending or twisting. It is a fusion, right? It's minimally invasive, but there's bone graft. We're trying to let that joint fuse up. And so if you're doing a lot of movement and things like that, we're not allowing body time to do its work, its true magic. And then we have a polar ice machine that we strongly recommend our patients to use. And what that also helps with is obviously ice. So you're keeping down the inflammation, you're keeping down the pain and the swelling, and that helps speed up recovery, would you say?
Yes, and I have also used the back brace, so that has helped, and I guess that just basically that somewhat stabilizes the back and doesn't allow you to jerk,
Yeah.
move around.
Yeah. We did the first one about 2 months ago, and we did the second one. So we did one side first, and then we just did the second one 2 days ago. And so one thing, how do you feel like now, 2 months into recovery, how do you feel like just the overall process has been, just slowly going back into activities, and has it allowed you to kind of pick up what you've been wanting to do, or what you feel like you haven't been able to do before when you were in a lot of pain?
Well, I was. My goal still is to go back to the rock steady, the exercise regimen for people with Parkinson's, and I'm not able to do that quite yet. I can't get down on the floor and get back up and all that. So, I mean, that's still my goal.
That's the goal, and that's my goal for you, because for us, it's always, what is the patient's expectation? It's not a success unless we can get the patient more functional, right?
Yeah.
Today, actually, so since the first time you had this done at VSI, we have the hyperbaric chamber, which helps speed of recovery of procedures, but also with incisional healing. I know you can't really speak much to it because today was your first time using it, and it's only been 2 days since the procedure, but we didn't have that as an option for you for the first procedure. I know you literally just 30 minutes ago finished. Do you feel any difference with using that this time around versus the last time?
Not really, to be honest.
Okay.
Honest with
And
you.
we recommend it takes maybe once a week to do like 3 to 5 sessions. So for our viewership, I know you live a little further, so it might not be feasible. But it does take a few sessions, but sometimes people do feel some sort of impact. So just want to, right? And we're not only here to highlight the good or the bad, we want to highlight everything. 2 last questions, and again, thank you for your time.
And I had no problem with being in the chamber, and if you said I needed to do it, 3 times a week, I'd show up. I mean,
Yeah,
I'd
because you're
want to do it.
motivated. Yeah. And we usually just say once a week for the hyperbaric, but or twice a week max. But if that's something, we'll talk about that for sure. 2 last questions. One is, do you feel like you have any special tidbits? I know you mentioned the icing, but now that you've been through a patient, maybe something I told you or something you expected versus your own journey in recovery, what can you maybe some wisdom for the next person?
I guess the best thing, having done what doctors don't like, everybody gets educated on WebMD, and they think they're experts. And I guess I've read tons of stuff. Being in the Parkinson's class, it's another set of issues, but everybody shares the good and the bad, and so I think I had, and I still have, I think I have reasonable expectations for success. So I didn't think you would hit the spot, and I'd be doing cartwheels in the street next week. That wouldn't be the case. And like we said, that's like Maine and Maine back there at the SI joint, and there's just like a bazillion things that could be wrong. So no, I think to have reasonable expectations, because I think to go through any procedure and your expectations aren't aligned with how it's going to come out, it's sort of sad for everybody.
Yeah. Well, I thank you for your time. That's all the questions I had, but we have our medical assistant in the room. Is there any questions that you can think of?
I think the one thing, if you could speak to Mr. Lucas, is just because I know you mentioned that like deep pain that you had on the first side, the left side, that was a month and a half to 2 months ago. Kind of, which was one of your kind of chief complaints. How's that been since we've done the first side? Speak to that.
Yeah. No, the first side, yes, the sharp pain that you get, it's sort of like getting stuck with an ice pick. I don't have that on the left side. So no, you classify, you put a check beside it, it'd be a success. And I think that's the way the right side is going right now.
Sure.
I haven't had that.
Sure. That's great to hear.
And I think that brings up an important point of sometimes communicating that properly. I had asked them before we started of how could we have communicated better, and that was going to be my second question is, hey, the SI joint, which I was showing Mr. Lucas, is one joint in this area, right? But then you have your gluteal muscles, you have your facets. There's a lot of possible pain generators in this area, and so managing that expectation of, hey, like that deeper, that consistent pain, part of it is gone, but I do still have some pains. And working together, there may be other things in play, and it's not just 100% generated by this area because the body is so integrated and well connected. But yeah, thank you for your time.
Oh, my pleasure. Thank you.
Yeah.